Hi, everyone. Welcome back to another episode of the Slimming Surgeon podcast. I am your host, Dr. Kandace Kichler. Today with me, I have a very fun and interesting guest. You're going to get to hear the patient side of a facelift. So without further ado, I want to introduce my guest, Jill Wilkinson Arroyo. She is actually a marketing manager. She's a patient coordinator, and she is a woman of all things at Haas Plastic Surgery. So I've been working with her since I started my fellowship and completed my training, and I'm now employed at Haas Plastic Surgery. But her background goes way back. So she's going to tell you all about her history and what she does now. But before that, she was in the city, in New York City, doing advertising and PR, and she made her way down to Florida. So, Jill, tell us a little bit about yourself and your background, and then we'll get into the meat of this.
Sure. I did my marketing training in, as you said, New York City in the ad agency business. Grew up in the Northeast in New Jersey, outside of Philly. Headed down south when I got married into Philly, did some marketing for a YMCA, fundraising, development. And then we moved south to Florida about 25 years ago. I knew Dr. Andrea and Brian Haas and ran into them at an event and said, hey, I was sort of looking at a job. And they said, come talk to us first. So they brought me in to handle a lot of their marketing. I was on a part-time basis at the time because I had some little kids. And it went from there, from 2 days a week to 3 days a week to 5 days a week. And I've been there 25 years.
So you were telling me earlier about how you would go in and listen to kind of like the doctor consultations with patients. Like, how did all this happen from being in the ad business and marketing to coordinating with patients?
Sure. Well, initially it was, handling what ads we were placing and things like that, because in this market, advertising is okay. And plastic surgery was still relatively, new in the area. And so we wanted to get our name out. But then Dr. Haas's would ask me to follow them into the exam rooms as an escort and to hear basically what they did. My background wasn't medical. So I did, and I just found it super fascinating. Always found something cool to talk to the patient about. And eventually Dr. B and Dr. A, as we call them in the office, said, you should talk to them and just begin the consultation, bring them to us, and then I would do the quote for them and follow up and schedule them. And it's so much fun. I mean, dealing with the patients is just the most rewarding thing.
Right. So in other areas of medicine, there's no such thing as a patient coordinator. And this was something new to me when I transitioned into plastic surgery. You have a critical role because you answer so many questions and you relieve so many anxieties before a prospective client or patient even meets the doctor. And I think that that's really unique and fun. I feel like that's got to be fun for you.
Well, it is, because back when we weren't digital, I would open up the chart and I would always find something about the person that I was talking to that I could relate to. Oh, I see you live part-time in New Jersey. Oh my gosh, I grew up there. Or I went to University of Delaware. Or I would just find, oh, you play team tennis? I do too. Something kind of fun which would relax them and make them tell me more about them, because most of the time people like to talk about themselves. So once I kind of found out a little bit more about them and why they were there, I think I made them feel comfortable in making this okay to do. Okay, you're going to meet the doctor now. They're going to talk a little bit more. They're going to explain it. My job is really to kind of explain how the surgery's done, where we do it, the recovery process, the preparation process. So by the time they would get with Dr. Andrea or Dr. Brian and now Dr. Kandace, they kind of get it. They don't feel as fearful.
Right.
So now they're standing with you and they're like at ease a little bit. Oh, I'm looking at this or looking at that. And all of you make them very comfortable, which I think that's a plus in our office as well. And then they come back to me and they're like, oh gosh, I'm so excited. Or I still have these 3 questions. Or can I call you tomorrow because I want to pick a date? Or and that's part of it. And I think the most rewarding part is watching them go through that as well, because they kind of become friends.
Yeah. No, I know. There's people. I was when I first started working here, I was in Saks Fifth Avenue wearing my scrubs after work. And this random gentleman stopped me and was like, does Jill still work there?
I know it's true.
I know. You're like the face of Haas plastic surgery. It's so good.
Oh, it's fun.
So you kind of touched on this, but let's talk about how plastic surgery has changed through the years. Like from when you first started doing this until now, like what kind of changes have you seen take place?
Well, when I first started there, number one, there was no internet. Number two, there was no Botox. So what I was really talking about was facelifts, eyes, breasts, body. And I think the people that came in the door thought, you know, okay, I'm going to do this. living in Palm Beach County. I'm going to do this. But they were either super nervous or they came from New York and they're seasonal and they are used to doing it. So as the influx of patients come in, not being really aware of certain procedures, I was doing a whole lot more educating on what they could have done. Mm-hmm. Now it's changed. I mean, there's so many magazine articles, social media now. You can go to any website and there's tons of stories. There's Real Self. There's the plastic surgery websites. There's people's websites. It used to be that you advertised on Yellow Pages and in the magazines and the newspaper to educate the patient. And now I think people's friends are doing it. It's okay to do. You read about stars who do it, but you read about every day that people that do it. And I think that's what makes it a little bit more easy for people to walk in the door.
Right.
And I think a lot more people are more educated. In the beginning, I found I was doing a whole lot more like consultation about what an eye lift is, what is a breast lift, what is liposuction really going to do for them. Now I think they come in and they ask me these questions like, well, do you do lipo 360? Do you do the Brazilian butt lift? Do you do an augmentation with a breast lift? So they're a little bit more aware of what's out there, just for the nature of where we are in our life right now.
Exactly. And I think, having information at our fingertips is good. There's obviously some negatives to it because then you get people asking for really weird stuff. Like I literally had someone ask me the other day for Botox of her trapezius muscles. And there's people that are advertising this is giving you an elongated thin neck.
Yes.
Like, okay, let's be serious. Yeah. Like how much are we really going to change the structure of a major muscle when we don't have, standard dosing and, whatever. But so we get weird requests all the time. And I think it's fun to kind of like pick through those and talk to the patient about them. But, it's also really nice when someone already knows exactly what they want to some degree and you're able to guide them or reassure them that, yes, this is what we're going to do.
Exactly. Or they didn't know they could do something.
Yes.
I didn't know that I could do a breast reduction without drains. I didn't know I could do liposuction and be working in a week. I mean, there's a lot of things I think they're scared of general anesthesia. And we don't use general. We use IV sedation. So I think there's a lot of things people think about that other people tell them. It's like anything. It's like, oh, I heard so-and-so. It's like whisper down the lane. Yeah. But once you're sitting in front of the coordinator and now the doctor, it's like a whole lot more believable, as well as all of our office staff. I mean, you can look around our office. Pretty much almost everybody's done something and looks normal. That's what I always say to people.
Exactly. That's the key, You walk into our office and yes, everyone's beautiful, but everyone looks like themselves. Yeah. And I think that that's really important. And also a telltale sign when you go into a plastic surgeon's office, like, does everyone look, overstuffed, over plumped with too much filler and or too much work done? Or do they look like really nice ladies or gentlemen?
Well, I always say to patients too, when they say, well, I'm going to go on a couple consults. Okay, you should do your legwork. But I always say, make sure you look at the people in the office. It's like if you go to a dental office and everyone has bad teeth, do you really want that office doing your teeth? Right. Same thing with orthodonters or any of it. So I think doctors want their staff to look as good as they can look without looking, I should say, for the most part, most doctors want their staff to look as good as they can look and feel good about themselves. Because let's face it, plastic surgery isn't just about surgery. It's about self-confidence. It's what does that give you? And I think that in general can be a huge selling point. A little girl with a big nose who is so embarrassed and she has a rhinoplasty at 16 is
life-changing.
Life-changing.
Yeah.
Otoplasty, which you don't even think about because people have really long hair. Those little girls, even older adults, it's like, this has always bothered me. I've always thought about it. And when I first started working and talking about breast dogs with young girls, thinking, oh, okay, so they're going to do their breasts, they're getting it for graduation. But then all of a sudden you see them and they have, let's say, a big asymmetry.
Yes.
And for a young girl going off to college or going into a career, that's like
huge,
very upsetting, because we are a little bit too focused on all of ourselves. But on the other hand, it's life-changing.
Yeah.
And that, I think, is the most rewarding thing, is watching that confidence bloom in a lot of patients, whether they're 18, whether they're 13.
88.
Exactly. Just freshly lost their husband, and they're doing a little something for themselves, or lost their wife. And more men are coming in, which is super exciting. Mm-hmm. But that is the best part.
I love it. I love it. Okay, so you kind of touched on this, but I want to just ask it more directly, and then we're going to get into your facelift. But so what are some of the most frequently asked questions or anxieties that people ask you? Because a lot of times they ask Jill instead of asking me or the other surgeons. They just look at us and want us to tell them what we should do. But a lot of the other, questions come out in your office.
Absolutely. So I think what they are most concerned with is, what's my downtime? Mm-hmm. Like, do I really have to stop playing golf for 4 weeks if I do my facelift? Do I, which is common. I mean, we live in Palm Beach County. You can go outside every day and do things, except in this heat. But they
sweltering, literally sweltering today.
It is. And I'm dressed because it's cold in our office when we do surgery. Right. You did surgery today. But anyway, but it's does it hurt? Mm-hmm. Like, what does it really feel like? My girlfriend did it and she said it was awful. I'm like, no, it's really not that bad. And I can easily go find someone in our office that just did a tummy tuck or just did something, or I can speak from my experiences. Mm-hmm. Is it, what kind of anesthesia? I heard it's, if you use general, that's so bad for you. Well, we use max sedation, twilight anesthesia. Will I still look like me?
Yes, that's a huge one.
That's a huge, huge one, because I think plastic surgery got a bad reputation with, I don't know if you ever saw, the New York Post, the cat lady.
Yes, I loved the cat lady. And Joan Rivers loved her. But these people are overdone. We acknowledge that.
Some of them are, but Jane Fonda looks pretty darn good.
Jane
if
Fonda.
I look like that at 85 or whatever.
Or Martha Stewart.
I know.
Yeah.
She just posed for
Vibes.
Sports Illustrated.
She did. I don't even know. I think she's 83 or something.
I know. But
insanity.
Listen, here's what I always say to people. You're not going to win a medal if you wait. Oh, I'll wait till I'm 60 to do my first facelift. I'll wait till I'm 65. I'm going, why?
Yeah.
Well, what is my girlfriend going to say? I go, don't
Who cares?
tell her. Don't tell her.
Yeah.
Here's the thing. Sometimes, especially in Palm Beach County, I will say this. We look at people and we're like, wow, she looks really good, or, ooh, she looks really overdone.
Yeah.
And people will even stop you for your hair. Like, where do you go for your hair? You look fabulous. I'm like,
you should
really?
see my DMs.
That? Yeah. Yes.
Yeah.
Right? Or where do you get your eyebrows shaped? What's that lip color? No one's afraid to ask that anymore.
Yeah.
So I think that's kind of cool. But I think now people are not afraid to do, I shouldn't say afraid. People are okay with approaching the subject in a little different way.
Yeah.
Maybe they start with a little Botox. Maybe they start with a little filler. Maybe they do just a halo or BBL laser.
Right.
It's
Botox is the gateway drug.
Right.
Just kidding. Don't tell your husband that.
Yeah.
He won't let you do it.
Well, for men, it's cool sculpting.
Yes.
Men will come in and they'll go, oh, I thought I'd never do this, but I don't want anyone to know. So we'll do a little cool sculpting on them.
Yeah.
Next thing you know, I'm in there telling them, someone could come in and do a little Botox for you. Now you'd probably look great.
Yeah.
I remember one of the first cool sculpting guys I did. He was so funny. And he actually was an actor. And he goes, well, maybe I'll start with how do you do the eyes? So then he not only did cool sculpting, his next procedures was eyes, brow, and face.
Wow.
And then a couple years later, he goes, okay, cool sculpting worked, but I really want to
really get it
done with it. So he did some liposuction.
Yes.
So it is a gateway. It's and why not? Isn't dyeing your hair a gateway? You go for your first haircut when you're 5 in the little chair.
Right.
And now next thing you know, you're getting your nails done. And I don't think I had a real manicure and pedicure until I moved to New York City. So,
yeah.
it's just, I mean, that's just the way it is, right?
I know. It's not a bad gateway. It's like,
No.
it's to be a more confident you.
Exactly.
So you got to do what makes you feel good about yourself and you're happy with. And if that's nothing, then that's fine.
Exactly.
But we're here to help, you know?
Exactly.
Okay. So let's talk about your facelift. Okay. So you guys listening aren't going to get to see this, but everyone who watches the episode or sees some of the clips online, you will see that Jill is 10 days. Yes, you heard that correctly. 10 TEN days post-op from a facelift. So I know a lot of us think that a facelift entails this like month-long hideaway where you're bandaged up and no one can see you and you can't even go to Publix. But here we have Jill, literally 10 days post-op. So another name for facelift is rhytidectomy. For those of you who are looking up technical terms, we do the classic SMAS facelift. Dr. Brian Haas was her surgeon. And tell us about it. Tell me about your experience. And then I'll ask some detailed questions.
Okay. So this was my second facelift.
Yes, we were going to get into that.
And I did it before. So I am 63. I did it when I was 51.
Okay.
Because and if you were a patient, this is what I would say, as your face ages, the fat comes forward in your face and it starts to fall. You'll notice that a more mature patient has a more rectangular face.
Yes.
You can get fat coming forward in your lower lid. You can get a heavy brow. So in this case, I did the lower face. We call it a mini facelift. You could call it a neck lift.
Right.
So in this case, it addressed my neck and it addressed the jowls.
Okay.
So my first one, I was pretty pleased with it. And the reason why I did it, I mean, I was working there long enough to, and I was ready to do it. I'd already done my eyes after a divorce. And I felt like that was pretty easy. No one really said anything. All my tennis friends are like, wow, you look great. Your hair, did you change your hair? Did you change your face?
Right.
So that was really easy. And then when I did the lower face, it was very similar. In fact, my mom and dad came down like 4 weeks after I did it. And my mom just looked at me and she goes, did you put like something in your cheeks?
Oh my gosh.
And I said, oh, Mom, I do Botox and all that. I mean, because to be honest with you, my mom in New Jersey, she was at a point in her life where she wasn't going to do it.
Yeah.
I think if she had lived here, she might, because she had great skin, Italian descent. But I didn't want to make her like
uncomfortable,
feel bad.
Yeah.
And also, here's the real secret. I didn't want her to tell my aunt, who would tell my whole family. And I was about to go to a family wedding, and I didn't want to be doing consults.
You didn't want to be the topic of the wedding. Yeah.
Yeah. So
exactly.
It's okay, though. I mean, I don't mind talking about it. But so the surgery's about 2 hours, depending on each patient, for the lower facelift. The incision is along the inside of my ear, around underneath and behind my ear.
Right.
So,
which we really can't see with these headphones.
You really can't. You really can't see it.
No, but even without the headphones on, it's like barely visible. It's hidden in your hairline. No one would know unless they're up close examining you.
Yeah. And this time I knew I guess the first time was just as easy. But I knew how to take care of myself. I mean, I had my boyfriend with me overnight, and he just did cold compresses on and off for the first couple of days, every 2 hours. I used the Valium.
Okay.
We give our patients arnica as well, which is a homeopathic remedy for bruising. I ate fresh pineapple. I came off my vitamins. I don't really take any other medication, so just coming off my vitamins. And I really rested. I watched lots of Netflix and whatever I was watching. I tried to read, but I'd fall asleep. And I took advantage of the fact that I was catching up on some sleep anyway. But it was the first
not terrible,
right? Oh no, it was not
at all terrible.
No,
right. Did you take pain medication?
You know what? I did, just so I could the head wrap was kind of annoying, but not annoying enough that it was painful.
And you wear a head wrap for how long?
Just overnight.
Okay.
So I literally had it on for, I think I got home at 4:00 and it was off by the next day at 9 in the morning or something. So it was very easy.
Right.
And then I have a little headband that I wear still at night, but I don't really need to.
Yeah. And other supplies that you needed to have at home. Let's pretend someone listening today is interested in having a facelift and they're terrified of the recovery. Like, what are some things that you need to have on standby, or how long do you need to have somebody at your house with you?
I would say it's a good overnight. I mean, depending on how healthy you are and your own fear factor. I knew how to take care of myself. So, I mean, At least a good 2.5 days. I did the 20 minutes on, 2 hours off of cold compresses.
And that's to help with swelling and pain. Okay.
I used the Valium to rest, to really make sure I rest. I didn't have anyone come over, so I wasn't talking.
Right. This is not the time to have a facelift party.
I would not be doing this podcast last week at this time, but but I felt okay.
Yeah, that's the thing. So you actually feel really good.
Yeah.
And you want to do a lot, but you're not supposed to, because we don't want to have a complication, which there are few, but they are real. And so there are strict instructions during that first week, especially, that you really can't talk a lot.
You really shouldn't talk a lot. And in my case, I didn't need to oh gosh, I should vacuum, I should do the laundry.
Yeah, none of that stuff.
And I know that's our nature, is to go, oh, look over there, I can,
right. When you're home, you find a million projects you should do, but you just don't.
And actually you do want to do that. And that's what I tell my patients. I'm like, you're not cleaning out your closets. You're not emptying your drawers out. You're not going through your wardrobe. This is the time, because believe it or not, that kind of stuff can really raise your blood pressure.
Yeah.
And we want someone to have a maintained
low normal blood pressure. Exactly, because that prevents hematomas, which is bleeding under the skin. That can, it's not going to really cause a huge complication, but it might mean you need to have it drained. You might have to go back to surgery, different little things that we don't really want to deal with.
No.
So keeping your blood pressure stable, chill, meditating if you need to meditate, but mostly just taking the Valium.
Yeah, taking the Valium, and I watched lots of YouTubes.
Yeah.
I had all the next decorating ideas going, which, hey, listen, we have that at our disposal, so that's kind of fun to do.
Right. Do you feel too pulled? So some people are worried that they're going to feel that way and look that way. What's the sensation?
I feel tight around my neck, which is okay, because that is where I saw my more troubled spot, my neck getting loose again. I felt a little jowy. Mm-hmm. I didn't see it as much when I smiled.
Before, you felt like you had jowls.
I felt a little jowy, and so the tightness is kind of by my ears now, but it doesn't feel I don't feel it now.
Right.
But if I go to touch it, it's it's a little tighter there, which is okay. And I'm very careful in what I'm doing, because believe me, I want to be active too. I want to go back to my Pilates. I want to play pickleball. I want to do all those things I'm doing, but I definitely know I couldn't do it.
Yeah.
Right now.
You don't want to be whipping your head from side to side. Exactly.
No. And I wouldn't be on the Peloton, and I wouldn't, and a couple of things that I would normally take on as projects in my house, I'm going to move this plant from this side of the patio to the other. I'm not doing that.
Yeah. Just avoid that.
Yeah. So, but I think in 4 weeks, obviously we ask people to no exercise for 4 weeks.
Yeah.
But I'm back at work. Today was my first day back.
I was so glad to have you there.
Sometimes I would say, I'll probably be a little tired tonight.
Yeah.
But like I said, I've been eating well. Soft foods I had around, cottage cheese. I made myself egg salad. I had my favorite, club soda flavors in the house and that kind of thing.
So for recovery, good things to take would be high protein foods, because you want to heal, your body's healing and you need that for healing. But you spoke about having arnica and pineapple. So what do those do?
Well, the active ingredient in pineapple is bromelain, which helps with swelling. And arnica, I use the little tablets that you stick under your tongue, but we also give our patients a tablet. And I did that about every 4 to 6 hours.
Right. So arnica is for bruising and swelling, and you can take it after surgery. We have everyone stop supplements just because A, you don't really know what a lot of the supplements you take contain, but B, they can cause bleeding and bruising. So we stop supplements 2 weeks before and at least 2 weeks after. But arnica is okay. So we want to do the arnica, some pineapple with bromelain, and you have no bruising.
Well, I also want to say that I did do a manual lymphatic drainage with someone that we refer to in our office a lot. The reason I did that is about back when I did my first facelift, we had a woman who was teaching the Vader method of manual lymphatic drainage, which is a specialized method. And she had done a study with our office, and she had taken a lipo patient, an eye patient, and maybe a breast patient. And then when I went to do my face, she goes, I'd like to use you. She had done that for me, and it really made a nice difference. So the woman that I referred to now, I texted her, and I said, hey, I'm doing this. What day? And she goes, why don't you come on Saturday? I did my surgery Thursday. I went on Saturday, and manual lymphatic drainage is the softest massage. It doesn't even feel like you're doing anything.
Right. It's not like the stuff you see on Instagram when you think lymphatic drainage. Like I send my lipo patients for some of the more aggressive stuff, especially if we're working on contour defects and things like that, or fibrosis, maybe from other surgeons. But this is light touch, correct?
So it's like she basically starts working on your neck first, and then she kind of goes up to the areas because she's familiar with surgery. And it's so relaxing. And I swear to you that I went home, took a nap, woke up. I was like, it's almost like I felt it draining. I'm like, okay. And I did another one. I looked pretty good at the second one I did a week later, and it was just as easy. But I also asked her for some tips because I said sometimes we get a little bit like the swelling goes south when we do facial work.
Right.
So it kind of stays a little softer here. So she gave me some tips on what to do for draining that area, which isn't like you press on that area. You actually, she said, because you're a little bit tight in the neck, she goes, just, pull down a little bit on this area, not pulling, but softly, because that'll help things to drain. And it sounds like hocus pocus in a weird way,
hocus pocus.
But it's not. And it's amazing. And she does a lot of very cool healing work, and a lot of people are trained in that method and can do it. So it's really neat. What else did I do?
Hold on. Before we get to what else you did, what kind of anesthesia? So you mentioned this earlier, but so many people are scared of general anesthesia, and so many doctors still do facelifts under general anesthesia. What was your experience with the MAC or sedation that you had?
So MAC is Twilight, given to you through an IV sedation.
Which is the same as like an endoscopy or colonoscopy.
Or colonoscopy. That's exactly how I tell patients. I'm like, have you ever had a colonoscopy? Have you had your wisdom teeth out? Or have you had any kind of procedures? And then they are more familiar with that. Right. And that's what we use for almost everything.
99% of our cases. Exactly. And even then we don't really use a lot of the general anesthesia medications. We mostly just use gas. But again, so tell it, like, how was the experience with that?
It's a really good nap.
Yeah.
I mean, it's a really good nap. I went into, it's funny.
We don't wonder why Michael Jackson liked propofol.
Yeah. You don't even know. I mean, I walked myself first I was sitting in the room, waiting. And then
wait. Maybe we should go back and walk everyone through what happens the day you have surgery.
Okay.
That'll be fun. Okay.
This isn't a typical thing because I actually worked a half a day, because,
oh my God,
because, I'm cool and I can work a half a day.
I remember that. Jill came into my office the morning of her surgery and was telling me something about social media. And then I looked at the schedule. I was like, she's having her facelift today.
I know you ran in and you go, aren't you having surgery today? What are you doing here? So I came, I basically went into the room we put people in to kind of have them chill out. So we have people get there an hour before their surgery, say goodbye to your loved one who brought you because we don't want him in there chit-chatting.
Right. Or giving you anxiety.
Will say this because this time I'm like, I told Wendy, who helps people get ready for their surgery, I said, I'm fine. I'll just work at my computer. Just come get me when you're ready for. She goes, no, get in that room.
Yeah.
So she gave me a Valium.
Good.
She gave me a clonidine just because she said, well, your blood
pressure is
a little bit high because you're yakking it up over there.
Yeah.
And I just chilled and I almost fell asleep. And then they came to get me. I walked myself.
So
into
you
the
get an IV,
room.
right?
Yeah, they started an IV.
So anesthesia comes in, starts an IV. That's literally the only thing that people might be, having a little bit of pain. You get a poke with one needle.
Oh, yeah.
Yeah.
Yeah. And that was very simple. And she did a great job with it. Actually, Tony, our nurse, did it. And she's like, oh, okay. And then I basically took a little nap. Walked into the OR. And Tommy Anna, who's our nurse anesthetist, was doing anesthesia that day. And she goes, you ready? I go, yeah, put me to sleep. And so I don't even remember the rest. Yeah. And I also had a halo on my chest at the same time that day. And I woke up and I was like,
did you wake up at home? Basically, because most people don't remember leaving, don't even remember waking up in the operating room. But you remember?
No, I kind of do remember. Okay. And I said, did it happen? What happened? But I'm always fearful, I'm going to say something weird. I'm like, what did
everyone thinks that. But honestly, being there when everyone comes up from anesthesia, no one says anything weird. You might be a little emotional, you might extra love the person picking you up. And I've never heard anyone like confess their sins or, like tell about when they cheated on their spouse, like you don't hear any weird stuff like that.
You might someday, though. I've heard a few things.
Okay, well, I
mean, a couple of times I'll go in and I'll say hi to my patients.
Okay, but we don't want to discourage the cheaters.
No, it was
Your secret's safe with us.
A little bit. I remember getting in the car and driving home, but sleeping the whole way there.
Yeah.
I remember walking into my house and I had my couch set up, so I had my pillows and my blanket set up.
Yeah.
And just basically lodged myself, not all the way flat, but sitting up and just kind of chilled.
Did you feel uncomfortable doing that? Like, were you in pain? Because I think that's a lot of things. That's another thing that people worry about, that they're going to get home and they're going to be in this tremendous pain and they're not going to be able to control it. Like, there's no pain.
No.
It's well controlled. And then we give you stuff.
Yeah, they give it to you in your IV. But then even when I woke up and I was sort of much more alert and ready to have something to eat, because you can't eat or drink for about 6 or 7 hours before your surgery.
Right.
I was hungry. I was ready for a cup of coffee, even though it was like 5 o'clock. I'm like, I'll have coffee now.
Yeah.
and I just, I started the icing. That actually feels good. It's not like you're in pain, but it feels good to have something cold.
Yeah.
The head wrap's a little bulky, but it's not that bad.
Yeah.
And I just kind of chilled. I used the Valium. I had something soft to eat. I just really, really took advantage of the relaxing. And that's what I try to tell patients. This is your chance to relax.
Right, to catch up on that sleep.
And it really does make a difference. I mean, we do tell our patients that because we can tell if they haven't been doing that.
We can tell. You have more bruising and things if you don't relax like we're instructing you to.
Oh, I've had patients have all their girlfriends over for wine and come in and tell the doctor that the next day. And I'm like, don't tell him that.
Yeah. I know. We always call our patients the night of surgery. So I called a patient the other day after her breast surgery, and this is a lady going through a divorce, and she wanted new boobs. And she's like, oh, yeah, all my girlfriends are over. I was like, please tell them to leave. You need to relax. You need to rest. You need to recover. Like, in a couple weeks, have the girlfriends over and show them off, but not the night of surgery.
Well, that's the thing. You actually don't feel that bad.
Right.
So you feel like, okay, life is just going on. It's not like you're getting a mole removed.
Yeah.
You're like having a flap of skin and tightening of muscles and things like that in this case. And breasts, too. I mean, tissues are being moved around on your body. Think about it. So it's pretty serious. I mean, I know we're talking about it lightly, but it is
real surgery.
It's serious. It's real surgery. Right. As my boyfriend calls it, you had an operation. I'm like, wait a minute, are we playing a game?
That's so funny. So wait, tell us about the halo. So you had that done on your chest.
Right. So years of sun. I'm a redhead, obviously. I did we have the BBL and the halo. I had the BBL done on my face a couple weeks before the surgery, which is for pigment.
Right. BBL is the broadband light. I think I've talked about it on the podcast before, but our laser is a combination. So the halo is more resurfacing. So it's going to be for texture as well as tone, but pore size, crepey skin, you know, it's just going to give you that filter and help with smoothness as well as some pigment and color changes. Versus BBL is a light treatment that can be done more frequently. It's a little less aggressive and it's really going to focus on browns and reds. So you had the BBL done on your face before the surgery?
Just the BBL. And then during the surgery, because the halo is a little more intense, they did that while I was asleep.
Right. So it's something nice to add on if you're having a procedure. Because,
absolutely.
Then you don't have to sit and numb for 30 minutes to an hour before. Like, you just go in, we do it, boom, you're done.
Yeah.
And you didn't feel discomfort on your chest when you were awake.
Nothing at all.
Right.
Nothing at all. I mean, I definitely noticed my skin feels much smoother. I didn't see
it looks smooth.
I didn't see any
like a baby's bottom.
Super red. Yay for me.
Yeah.
Anyway, but I'm really glad I did that while I was asleep. But I will do it again because we like to.
Right, and we can do your face next.
Yeah, exactly.
We in our practice don't do the halo at the same time of the face because we're very protective of the skin flap and we want to make sure that you have the best result from the surgery. But then later, a month later or longer, we can go back and do a little resurfacing with the halo to help with the pores and the texture because a facelift isn't cutting away the pores. It's tightening the muscle, tightening the skin, repositioning the underlying fat, but it's not doing those skin texture things. So that's what halo, BBL, gel, microneedling, IPL. That's what all of that stuff is for.
Right.
On top of your medical grade skincare that we got to do year round.
And then a little filler.
Yeah.
There's certain things a facelift will do, which will help the jowl line and the neck. But anything around your perioral area isn't going to be stretched. So you asked me before, do I feel stretched? That's what people are afraid of.
Mm-hmm. They're afraid they're going to look like they're in the back of a convertible with the top down, the wind blowing their mouth wide.
Yes.
Like that's what everyone who's anxious tells me they don't want to look like.
Right. And that's that old...
it's the Boca facelift.
Yeah. Or even like I call it the Palm Springs one too. Like, I mean, remember the decades ago of looking at people at a facelift, it was almost like they had this line pulled and it's like, they looked really scary. Yeah. But no, I think people understand that you're not going to look that scary. Now, here's the other secret, I think, in our office that we tried. It's not a secret.
I love secrets.
It's when do you start? Like, you know, I have a couple girlfriends are like, oh, you know, I'll just wait till one of my children want to get married. So I'm going to lots of children, you know. Yeah. Like I'm lots of events. And I said, well, why do you want to wait till she's going to get married? Don't you want to look the best you can look now? I mean, you're not going to win a medal if you wait till you're 60 or 70. Right. And enjoy your life now. Don't you want to look, do you dye your hair? I mean, do you buy a new car? Do you put new pillows in your bedroom? I mean, so you don't want to wait till, those pillows are so shabby, I need to go buy new pillows.
And that's exactly, if you wait until it's so bad, then it's going to be noticeable that you had something done.
That's the key.
Right. Versus when you start to feel a little laxity or, you know, you start to, you know, feel that under the neck kind of wiggle wobble. Right. And you can pull back on your sides of your face and feel that extra skin, then it's time to get a consultation. At least know where you're at. Know if you're ready or not ready. And that's what we can tell you. Right. But, you know, in general, 50 to 55 to 60, that's a good starting point.
I mean, some people have very poor collagen. And there's definitely different types of skin types that are going to do better at it anyway. Right. Someone who's been sitting in the sun, smoked most of their life. I mean, their elasticity.
And lost a lot of weight, maybe. Then those are game changers. And those people, you might even be doing this in your 40s.
Right. But I think if you start at least by 50 or 45, 50, you do a little bit at a time, just like you said, whether it's your eyes or maybe you don't do your lower lids, you need your upper lids or you need a little Botox, then you're kind of gracefully aging, if you will. So
Shino Bay just did his eyes.
Oh, he did?
Yeah, he posted it on Instagram. I need to watch all the videos. They look so good, though.
Well, I think a lot of people aren't afraid to say because...
You shouldn't be. Yeah. I mean, okay, I say that for myself because I would tell anybody what I did. But there's some people who are more private, and that's okay. But I love that people are putting the information out there and, you know, making it acceptable to explain your experience.
Right. And also, as I say to some of the patients that I work with, they're like, oh, you know, then all my friends think I'm crazy for doing it now. They think I should wait. I'm like, they just don't want you to look better than them.
100%.
And I mean, it's kind of true. But then people really are only looking at themselves. Yeah. Listen. Right. Do you know how many surgeries we did after Zoom and COVID?
Oh my God.
It was people, because think about it, when you're on a Zoom, who are you looking at? You're looking at yourself. Right. We did so many rhinoplasties, eyes. I did so many online consultations with the doctors because they're like, do you think he could see me? Like, when are you starting back at work?
Next hour. Yeah.
So it's true. And I mean, and it's okay. And it's all okay. But I tell people I don't make a big deal of it. I mean, but I'm not embarrassed about it. I'm not, it's kind of like anything. Did you just get new sneakers? Well, I'm allowed to tell. Yeah. You noticed? Oh no. You know? Right. You know, and I know not everybody is going to be able to run in and do something right away, but it is something I think people aren't afraid to do as much because it's out there.
Right. So you've had two. I think some people are worried, well, if I do one, I'm going to need another and another and another. And I think we should kind of address that. Like, what are your thoughts on having this done more than one time?
Well, now that I've done it, I will say I was thinking about doing it this year anyway. I have a 45th high school reunion coming up, kind of a weird thing to say. And I will say this in a nice way. I grew up where people aren't really pursuing this as actively as, let's say, we are in this community.
Yeah. Like I'm from Alabama. People do almost nothing there except their boobs.
Yeah.
Okay.
And I would never say to my friends, you should think about doing this. But if they asked me, I would be happy to tell them. So I was talking to Dr. A about it when I got back from a vacation recently. And she goes, so when are you going to do your face soon? And at first I was like, well, gosh, do I look that bad? And then I was thinking, I don't know. Here's my dilemma. Do I do it before? Do I wait and do it in the fall? And she said, I understand your reasoning. Do what you have to do, but filler isn't going to do lift the jowls anymore. Do it, and not that it was anyway, but filler isn't the cure for looking your best at this reunion. She said, but if you don't do it, fine. Mm-hmm. But she said, if you do it, you'll be glad you did. So think about it. Mm-hmm. And so I did, and I was like, put myself on the schedule for next week, and I'm really glad I did. And I think my boyfriend was nervous I was going to look a little different.
Sure,
but he's like, wow. He goes, that's just amazing. And, it's funny because when you tell people, so many of my pickleball friends have already come in the door and done some fun stuff. And some of my other friends through other friends are like, well, Jill, can you, you were mentioning it the other day. I remember when I first met his family. Yeah. And one of his relatives said, will you talk to me a little bit about the eye thing? I think I'm ready to jump into the deep end of the pool, or at least the shallow end, and work my way to the deep end, as I always say. But I think if I feel like I'm a real person, that's like,
you are a real person.
It's okay to do, and they're like, okay, I think I'm going to do it. She doesn't look strange, and they would say to their husband, look at her, look, she looks fine. So I think that's the other part of it. As long as you manage your expectations as well. Because
that's true too. Yeah. Because you're not going to have a facelift and look 35.
No.
That's not going to happen. Most people would not want that to happen because then you would look dramatically different, but also it's not even achievable. You've got different skin texture, you've got hormones in play, there's a lot of things that go into why you look the way you do at a certain age, but we're just refining that and making you look like yourself, but very refreshed.
Right. And that's kind of how I feel, to be honest with you. I'm ready to get back to exercising, I will tell you, but I'm okay. I'm going to be a good girl because
it looks so good.
You can get a hematoma just pulling a shirt over your head. So I'm being very careful. But.
Right. So let's talk about briefly the negatives that you might perceive with having this done. We're talking about how great it is and how wonderful you look, but what are some of the things that you have to take into consideration when you're going through this? Obviously there's a cost.
Well, cost is a factor, but there's financing like anything. I mean, listen, people come in and telling me they're doing their whole veneer set.
Oh my gosh.
It's $60,000 to $80,000.
It's crazy.
So it's what your priorities are.
I'm Crest White strips all the way. No, just
you have perfect teeth.
Sign me up.
I know. But
if anybody wants to sponsor my veneers,
stop. You look great. But listen, I can't tell you how much I've spent on Invisalign and all that stuff. But things change, right? Mm-hmm. So I don't want to look perceivably like, oh, she's trying too hard. Mm-hmm. But I want to look the best I can. But I think the fear is, I have to do this again?
Yeah.
Well,
yes and
some
no.
surgeries you don't.
Right.
Most likely you're not doing a rhinoplasty again.
Right.
You're probably not doing an otoplasty again.
Or a tummy tuck.
You may never do a tummy. Definitely not doing a tummy tuck. But let's face it, I tell young patients, if you decide to do a breast aug now, someday down the road you might have nursed 2 kids and you might have gained and lost weight, or you might not want implants anymore. So I said, you're probably going to do a cosmetic breast surgery again. Mm-hmm. And that's okay.
So similar with a facelift.
Yeah. So facelift, I started at 51. I'm 63. Do I think I'm going to do it again? I don't know.
Yeah.
Everybody's
different. And at different stages of your life, you may feel like you want to do it, or you may feel like, no, you don't need to.
Right. And I have my friends tell me that. Mm-hmm. And honestly, I didn't even tell a lot of people. I just told one of my girlfriends that had her eyes done in our office. She lives in New York. And I said, I have a confession I did. She goes, oh my God, send me a picture right now.
I know.
Because she wants to do it and she's excited by it. But it's kind of like anything. I remember when I first dyed my hair, I had 2 gray hairs. My girlfriend's like, let's brighten this up a little. Let's brighten this red up, girl. Yeah. And I was like, really? Because then I have to do it again. And she goes, well, yeah, but if you don't want to, you don't have to. But I was like,
exactly. The same thing with Botox. If you don't like it, you don't have to keep doing it.
Exactly.
No one's forcing you.
But it's like anything. You're going to wear the same T-shirt? Or are you going to buy a new one? Or are you going to okay, styles change.
Right.
I don't think people's faces are going to change drastically, but at least you can age gracefully and look the best you can for whatever age you are.
Right.
And if it means you need a little tweaking, whether it's filler, Botox, Halo, BBL, or facelift, eye lift, brow lift, I mean, then why not? It's not that hard of a surgery to go through. It's not like, and hey, let's face it, even hip replacement, you're going home the next day.
I know.
Right?
I mean, you don't walk out of there in a hip replacement, but you walk out of surgery when you've had a facelift or when you've had any of the procedures that we do, because we do them in our office.
Yes.
I think that's something to talk about.
And we're Quad A certified. I mean, listen, just like a hospital, we have all the emergency equipment. And I will tell you, I've worked there 25 years, and we're not going to operate on someone who is sickly. We're going to get clearance. We're not going to do anything like that, because you're not only taking your own life in your hands, but you don't want the doctor to put himself in a situation. So we turn patients away if they have a history of, anything,
heart issues,
anything like that. So it is still a very serious surgery. This is still healthcare.
Right.
It's not just, Play-Doh that you're maneuvering. It's, very serious doctors, Dr. A, Dr. B, all take it very seriously, but make it wonderful and, make it a good experience. And that's our goal, is to make this a really good experience, that you are happy that you did it.
Well, I think you look amazing.
Well, thanks, honey.
It looks so good. I can't believe it's only been 10 days. I can't believe it's only been whatever. You look so good. You would think you're like several months out in recovery. It
was pretty easy. And it's not always easy for everybody, but it's pretty, because of how we guide people through the process, coming off the vitamins, making sure they're done. You can't smoke.
Right.
You have to be off all your cigarettes. You have to take care of yourself. And once people get that, and they come in, I just saw a patient who did it the day before me today. And she was so cute. She goes, I feel like, God, did I look that terrible before? And I said, no, but you look youthful. You look so, she goes, can I go back and work at the turtle place now? I said, give it another week. She was so cute.
So cute.
She felt really good. And I knew she felt like she could look in the mirror again. And that's really, when you look in the mirror and see the person that you want to see.
Right.
Because let's face it, some people come in and I'm like, I can't stand looking in the mirror anymore. I can't even,
Right.
And I'm like, well, there's things you can do, because the reflection
there are things you can do.
Is not how you always feel inside. If you're playing tennis and you're on the golf and you're on your boat and you're just having fun with your grandkids or your kids, you feel youthful, but you can't lift your jowls in the gym.
Yeah. It's so funny. It's so true. Okay. So you obviously had surgery with Dr. B because you work there and you trust him and you've seen his work.
Yes.
But what would you tell someone who is kind of like interviewing surgeons or going on different consultations? Like, what should they look for in a provider who's going to do some kind of work like this?
Well, look at their history. I mean, listen, everybody can look on websites now and see their work. They can read a little bit about the doctor's history. Did he train? Where did he train? Is it a reputable institution that you know? Do you know anyone that's gone there? I mean, listen, word of mouth is still, to this day, better than any advertising you could ever do. Also, how do they act with you? Do they have someone who is does a coordinating with you, gives you the education, or are they just putting you in a room and telling you, you need this, you need that, you need this? I mean, are they listening? I mean, do you feel like you're going to spend time with this person, whether you're having your breast aug done, your nose done, or a facelift. You're going to be in our office for the next 3 months, if not longer, because we'd love to see you in a year, just to see how you're doing. And their credentials, and their reviews.
Right.
I think those are really important, as well as just getting a vibe.
Yes.
I mean, I remember when I first moved to Florida, I'm like, I'll never find a doctor.
Yeah.
You know what I mean? And I interviewed, I went to one doctor, and then I didn't like how I was treated a couple times. So I switched, and I'm staying with that doctor.
Right. And you shouldn't feel bad about doing that.
No.
I think that's super important. Like, a lot of people, maybe they go to their surgeon or their doctor because so-and-so went there, or their parents went there, and they feel as though they have to go there, or this is the person with the best reputation. Yeah. We actually happen to have the best reputation and take really good care of our patients. You are going to win with us.
Hey, we worked hard at that.
But that's not always the case. No. I had a girl recently come see me for breast augmentation. She saw another surgeon who was recommended to her by a friend, and she said he literally spent less than 6 minutes with me, didn't look me in the eye, told me what I needed to have versus what she wanted to have.
Exactly.
And then she came to see me, and now she's having her surgery with me, you know,
Exactly.
so you really have to take that into consideration because, like you said, it's not just the work in the OR, which is super important, obviously.
Yes.
But it's also that entire experience, you know, like, are they going to answer the phone when you call?
Exactly.
Are they going to take care of you if there, Lord forbids, happens to be some type of issue afterwards? Are they going to, you know, guide you through the process and, you know, meet your expectations? And I think that that's something that we provide, but not everyone does. And you can find that.
Yeah. You definitely can. And I think that's a big key to it is, you know, are they able to get you in quickly? Are they able to talk to you? We have so many ways of communicating with patients now, whether it's texting or emailing, or we do Zoom consults. I mean, how many times have you and I done a Zoom consult with someone and you immediately have a rapport?
Yeah.
So the conversation, it's a well oiled machine. It's all from the time you call. Are they nice to you on the phone? Can they credential their doctor on their phone?
Yeah.
Is it just some operator answering? And then when you come in, do you feel like they care about you? Like it's your time there.
Right. I think another important question to ask is like, are you going to see the doctor after surgery? Because so many places nowadays, maybe you don't even see the doctor before surgery, and that's crazy. But also a lot of places, your follow-ups are all with someone else, you know, whatever physician extender is available is who you get to see. And I really hate that. Like, yes, it's happened to me that a couple times I've been operating when someone comes for their follow-up and I haven't got to see them at one specific visit, but I make a point to see them as much as possible every time. I'm available by text and phone, you know, basically at any time.
Oh, absolutely. I mean,
that's the world we live in. We have to be available.
Well, I coordinate for you too, and I watch you do it, you know, whether it's a Zoom call or I'm like, hey, she really wanted to just ask you a quick question, and you'll like, whether it's a DM or they'll find you on your, you know, your Instagram or whatever. The other thing I was thinking of was just, I had actually gone on a secret shopper a long time ago to like one of those like big places that does like the cheapo surgeries.
Yeah.
And I went with
Discount Depot.
Yeah, Discount Depot, exactly. And I was going as a friend of a person who was going to do a rhinoplasty. So we were in there and I was trying not to ask all the questions I wanted to ask.
The obvious ones, yeah.
But first off, the person doing the coordinating looked like she just rolled
out of bed.
Yeah, exactly.
Oh, God.
And then when the doctor came in to examine her, I said, "Are you going to be the doctor who does my friend's surgery?" And he goes, "Well, I don't know my schedule yet. I don't know because there's like 4 or 5 of us here." So I don't know. So that was a little scary. And then when I looked at the pictures, I'm like, "Who took these pictures?" Because I don't know. So just be wary, buyer beware of anything.
If it sounds too good to be true,
it probably is.
Yeah,
so,
right.
And there's lots of choices.
Of course. Yeah.
And, you know, we've been around a long time. The Haas's have been around. Your patients love you when they come in. And just, it's so nice to have that rapport because now I've seen patients pop their head in and like, "Hey, Jill, look at the schedule. I think I'm going to do my 3rd facelift in July or something.
Yeah,
Or I think I'm ready to do the tummy tuck now. You've been telling me about it." But then I think they feel like we're their friend as well. And they feel really super comfortable. I have patients who come in, they might talk about it for years. And then 3 years later after a consult, they're like, "Okay, so now my son's getting married. When can you get me in?"
Yeah.
I mean, listen, how many times have we had the emergency lipo?
Oh my God, emergency lipo. It is a thing. It is a real thing. I'm here for it though. I'm available on demand for lipo. Emergency lipo.
Emergency lipo. I need to get an address.
Yeah, I know.
But no, that's not really why people do it all the time. But it is kind of fun and it is amusing, but it's definitely a very serious thing. So there's lots of things to look at.
Right.
I mean, just how do you walk into a store and get a vibe? Like, do you want to just pick and choose from any place? No, you want to this is a doctor. It
is a doctor, right? We're doctors. It's real medical procedures, and we take everything very seriously. We dot our I's, cross our T's, all the things to make sure everything is safe and appropriate for everyone. But also we do it with amazing customer service, and that's thanks to people like you. I'm so fortunate.
Well, it is fun to work there, and Like I said, there's all aspects of it.
All aspects, including champagne o'clock.
Yes, yes. Having a happy staff is always important.
I know. Okay, so let's just, maybe end this by telling us, what you love most about your job, or maybe what what your most rewarding procedure was. I don't know. You just give us a little closer, and we will, kind of recap what we talked about today.
Well, I would say that the procedures that I've done over the years was to feel as good as I felt, or look as good as I felt.
Okay.
And I felt like they weren't over the top things that people sometimes perceive that you could. I mean, listen, lots of people look over the top and they're really happy with looking it over the top. But in my world, I just wanted to look the best I could. So that's the best part of the benefits of working there. The other part of what I do is just education to the patient and becoming their advocate, if you will. But I kind of look at it as more as becoming their friend too. Mm-hmm. Like, I want you to look amazing.
Yeah.
I'm so excited for you.
Yeah.
And make sure I see you when you come back. Because sometimes you get lost, next thing you know, I'm busy, or they're going to our Wellington office. But it's fun when they call and they're like, "Hey, I missed you. I wanted to show you. What do you think?" Or my mom's here now. She wants to do something. I've worked with patients. One of the first PR pieces I did was a little girl who had a dog bite on her face, and we got TV coverage for it. And now she's a grown up, and she still comes to our office.
Wait, I think I know about that. Okay, and we're obviously not going to break confidentiality.
But she is the sweetest thing, and it was just. Now her mom's there, and it's just like her grandmother.
It's like a family.
Yeah, and the trust factor. And I think Dr. B met her in the ER when he was taking ER call or something.
Yeah.
So we get people in the door for all kinds of reasons, mostly because we are mostly a cosmetic practice. But over the years, we have people come in because they couldn't see well from their heavy eyelids or something like that. Or in your case, in your business, people who lost a lot of weight.
Yep.
And now to see them get rid of that extra skin that they've worked so hard on losing weight,
right,
and have this new body, it's like
it's like wrapping the present.
They exude in the confidence.
It's like
that's
tying the bow. Yeah, I love it.
So that's the best part. Is just the as much as it's serious healthcare, it's so rewarding. It's very rewarding, not only for me, but really more for the patient to have that confidence shine through.
Well, thank you so much, Jill, for coming on so that you could share your facelift experience and kind of share the behind the scenes of our plastic surgery office. I think this is going to be so entertaining for everyone and just give a lot of people kind of that confidence to maybe make the call. Seriously, guys, you should just call and ask for Jill. 561-624-7777, because she will literally set up a Zoom call for you. If you want to go over things, if you just want to talk. I mean,
you can text us. You can email us.
Exactly. We accept text. We accept email. But thank you again. So everyone listening, again, this was Jill from Haas Plastic Surgery, one of our patients, but one of our employees and one of our family members. Please like this episode. Leave me a comment. Leave me a review. Follow my channel. Do all the things. 5 stars only. And we will talk to you next episode.